Hi, I'm Nurse Vince, and I'd like to examine the nerves around your face and head. Would that be okay with you?
Okay.
Okay. At this point, I'll be making observation to the patient to determine and to see the abnormality in the cranial nerve distribution. This might be something like ptosis, strabismus, loss of salivation, muscle wasting, of facial asymmetry. The first cranial nerve is olfactory, which is responsible for the sense of smell. Miss Lasha, have you noticed any problems with your sense of smell?
No, not at all.
Okay. And if the patient complains of anosmia or taste abnormalities, it can be explored with a smell tasting kit rather. So the second cranial nerve is the optic nerve, is the second cranial nerve, and the tested components are visual acuity, visual fields, fundoscopy using the ophthalmoscope, and I will test the visual acuity first. If the patient wears spectacles, then testing is done with the patient wearing them in order to correct any refractive errors. So, ma'am, this time we'll be testing your visual acuity. Are you wearing spectacles right now?
Yes.
So I'd like you to read some printouts. Take it with your hands and cover your eyes with your hand.
On the first day of the world, God made the day and the night. On the second day, God created the sky and water.
Okay, can you do it in the other side for me?
Heaven and earth were completed on the sixth day. Finally, on the seventh day of the world, God rested.
Oh,
So I'd like to test your visual fields. Could you cover your right eye with your right hand, please? Okay, I'd like you to concentrate in the center of my eyes. I'm doing this to bring my... I am doing...
oh,
I'd like to test your visual fields. Could you cover your right eye with your right hand, please? I'd like you to concentrate in the center of my eyes. I'm going to bring my finger, and when my finger moves, I'd like you to say yes.
Yes. Yes. Yes.
Okay, and the other side.
Yes. Yes. Yes.
Okay, so while I'm doing this, I'm comparing the patient's visual fields on my own. Okay, please do it in the other way.
Yes. Yes. Yes.
Okay. So, if an abnormality is detected, if a formal visual assessment by perimetry or central field assessment would be organized. While in fundoscopy, it is best to dim the lights in order to allow the pupil to dilate and to ask the patient not to look directly at the beam so that the eyes will stay in a fixed position. The cranial nerves 3 and 4, then the 6 are usually examined together. Tested components are the ocular movements under the pupillary reactions. First, I look at the ocular movements and I check at the normal resting position of the eyes and then the full range of its movement. Particular position, and I'm now going to test the movements of the oblique muscles. Okay, so you didn't see doubles in those positions.
No, not at all.
Okay. Looking at the individual nerve in terms of the abducens, innervates, and the lateral rectus muscles, which are responsible for abduction of the eye. When the patient has a left 6 nerve pulse at the lateral rectus muscle will malfunction when the patient looks horizontally to the left side and the left eye will not abduct normally. Patient will complain of double vision and the image will be horizontally displaced. The trochlear nerve innervates the superior obliques muscle in its action is demonstrated by asking the patient look downwards and inwards with the left fourth pulses. There will be a weakness of the left superior oblique. So, when the patient look downwards and inwards, they will complain of double vision with oblique displacement of images where the double vision stares on looking towards the right, the patient tends to feel that there's problem with the right eye rather than the left. So, follow the movements of the pen. Okay, so downwards and inward. Upward and inwards. Then side. Okay. All of the other eye movements involve the ocular motor nerves. These nerves also innervates flexators superiors, where weakness will result in ptosis, and the full picture of third node flashy. The pupil will be dilated, and the eye will deviate towards it outwards. So can you follow the pen again, please? Okay. So as the eye converge, both pupils are seen to constrict. The light reflex involves the perception of light by the efferent parasympathetic fibers carried by the third nerves. So I'm going to shine a light into your eyes, and I'd like you to look out into the distance, please. Okay. Okay, so I'm going to test the direct light reflexes and the direct reflexes. So I'm now going to test the sensation of your face. I'd like you to tell if it is feels same with each side. So, it is okay.
Yeah, it feels the same way.
Okay. The corneal reflex rather involves efferent fibers from the ophthalmic division of the trigeminal nerve and apparent for the facial nerves. If incorrectly touch the insensitive cornea, there will be no response. But when correctly touched, the cornea and a bilateral blink response obtained. This test is uncomfortable and it can't be omitted if sensory impairment is not suspected. The motor function of the trigeminal nerves is to innovate the muscles for mastication. So now I'm going to test your jaw muscle. Now please, can you clench your teeth tight and keep clenching? Okay. So, how do you feel?
I feel like my muscles are contracting.
Okay, again please. Okay. Can you open your jaw now? Can you open now your jaw? Then the
Go.
so I'm going to test your jaw muscle now. Please, can you clench your teeth tight? Then keep clenching. Then how do you feel?
I feel like the temporaries are contracting.
Okay. Again, please. So can you open your jaw now, please? Then the pterygoid muscle open, the jaw in the midline. Can you please keep it open for me? Okay. The pterygoid is strong and should not be able to overcome this movement. Can you move your jaw from side to side? Then, if the right pterygoid muscle is weak, the jaw will deviate to the right, and the left is weak. It will deviate to the left. Okay. Then next is the cranial nerve, which is the seven cranial nerves, which is the facial. So the facial nerve innervates the muscle of facial expression and vaccinator. I'd like to test your facial muscles now. And could you raise your eyebrows fully, please? Okay. Now, can you blow out your cheeks? Okay. This is a function of the vaccinator in muscle, and press gently and see if there's any incontinence of air to escape. Okay. Then the second one is the 8 cranial nerves, which is the vestibulocochlear, and the 8th nerve, the vestibulocochlear, has auditory and balance functions. I'm going to test your hearing, brother. I'm going to cover one air whispered and the other, and a number. Then please tell me what's the number I have whispered. Okay.
1.
Okay. I detect any hearing deficit. I would move on the turning fork test. I'm going to do some turning fork test. This is the vibrate test. Can you hear that vibrating?
Yes, I can.
And the other?
Yes.
Okay. Does it sound loud?
Yeah, a little bit.
Okay, that's normal. Then we're now going to the rain test. Then the rain test is this again. Okay. We're now going to do the rain test. Can you hear that vibrating?
Yes. Yeah, yes.
Okay. Please tell me when it stops.
Can't do it.
Can you hear that?
Yeah.
Okay. That's the normal for a rain test. We'll now go on to the repeat the test on the opposite side. Both of these tests rely on the fact that the normal air conduction is better than bone conduction. This test, the vagus nerve, now I'm going to test you for articulation, which involves coordination of tongue, teeth, and lips, and it requires the facial, vagus, and the hypoglossal nerves. Can you say the days of this week, please?
Yeah. Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday.
Okay. What would like to know? What would like to do now is to examine the back of your throat. Can you open your mouth? And can you say Okay. Do it again, please. Okay. The soft palate move upwards essentially to protect the nasal pharynx when the patient swallows. If there is pallor, the soft palate is pulled to the stronger side. Then the gag reflex is elicited by gently touching the posterior pharyngeal wall in its side and results in a gag response. If it is uncomfortable and not usually tested in the conscious patient, it requires both cranial nerves 9 and 10 for the different and efferent rows respectively. Then the 12 cranial nerves would be the hypoglossal. The 12th nerve is hypoglossal, and it innervates the water supply to the tongue. Now I'm going to examine your tongue. Could you please open your mouth? Okay, and the accessory nerve innervates the sternomastoid muscle and the upper fibers of the trapezius. I'm going to test your neck and shoulder. Can you shrug your shoulder for me, please? Okay. I'm looking for symmetrical elevation of the shoulders by the trapezius muscles here. Next is go get to turn your head against my hand, and I'm looking here at the sternomatoid muscle. Okay. Can we do it in the other side, please? Can you turn your head against my head? And again, while we're looking for the sternomastoid muscle.